The new book is called Pursuing the Triple Aim, and it's a book about aspirational goals and about leaders who are stepping out of the current healthcare system to achieve something that we've never achieved in healthcare in the U.S. before. That is the accomplishment of three great goals together. The first is to improve the health of the population. And the second is to improve the experience of care. That includes everything from access to safety and reliability to patient-centeredness and having your voice heard in the design of care. And then the third of the triple aim is to improve cost per capita.
Our book, Pursuing the Triple Aim, I think comes at a very propitious time in healthcare because I think there's this broad consensus that our current pathway is unsustainable. And while there are many things within healthcare that people argue about, often passionately, and in the political realm, often bitterly, I think we do agree that the pathway is unsustainable. So the question then arises, where are we going? And I think that's why the triple aim is so ideal and timely, because it provides a kind of framework that is comfortable, I think, and makes sense and is rational. And I actually think of the triple aim as a destination. It's where we're going. It's where we need to go. And I think that that gives people more and more throughout healthcare a sense of clarity about what they need to do. Obviously, it's very complex how we get there, but the triple aim is a very important symbol as a destination, and I think in that sense has great value.
So we went around the country and found these pioneers. We've been working with some of them for some time, and we began to tell their stories because I think that they'll inspire others to take the same kind of approach to improving healthcare. I call it building a bridge. They're in a successful way of working now, and in many cases they're moving from inpatient care to outpatient, or from episodic visits to how do I know what's happening when you go home from your doctor's visit between now and your visit in 3 months or 6 months. They're moving out of a comfort zone. And I think they need to build bridges that allow them to take their employees across, to help their medical staff to see a different way, to bring patients to a new way of communicating and connecting. And it's a leadership challenge like perhaps no other, to build a bridge between the current state and the future state and bring all of their constituents successfully across that.
I would love to see this book make that kind of a bridge. I would love to have policymakers read this book because I think if they read this book, they will come to a very simple conclusion, and that conclusion is that their job is to go out into the country and ask these innovators one question. What can we do to help facilitate your work? What is it that we can do that's going to help you be successful in your work? What is it that we can do to remove barriers, whether those are regulatory barriers or whatever they are?
We know we need new models, and we're hoping to inspire people to look at some great new examples and to say, I can do that. I can start here, like Blue Cross Blue Shield of Massachusetts, or here, like Health Partners, or I'm more like Bellin, or I'm a single practitioner like Tony DeGioia. But to say wherever I am, there's a place I can start, and I can take steps toward solving this major crisis in my own local patient panel, in my hospital, in my community, or in my country.